Hi, my name is Melanie and I am your IVF nurse. Today's topic is kind of keeping in tune with, how great Canada can be, and living in Ontario. The Ontario government has now decided since December 21st, 2015 that they were going to implement the funded IVF program. Now, in order to be eligible for this, you must have a valid Ontario Hospital Insurance Plan card, so the OHIP card, and you must be under the age of 43. And that pertains to third-party reproduction as well. Egg donors must have a valid OHIP card, as well as surrogates, and at least one of the intended parents must have a valid OHIP card. With the government funding, there are an overwhelming response to it. Apparently there is, with the funding that's been allocated, it seems to be that there are 20,000 patients in Ontario searching for only 5,000 spots, which have been allocated out to the fertility clinics across Ontario. Now, every clinic does have their own way of how they've instituted the program. Some have a wait list that it's based on first come, first serve. Some do a lottery system. However, if you're in a fertility program, then it's always probably on your best interest if you meet criteria, so having a valid OHIP card and being under the age of 43, to check with your clinic's policy on how to access the funded IVF program. Now, just to touch a little bit on the insemination program, there is no age limit, but you do need to have a valid OHIP card for the inseminations, and this is for one insemination per 21 days. So one per cycle, as opposed to doing two inseminations in one cycle. Now, specifically with the funded IVF program, and if you're doing inseminations, the government does not cover the cost of medications. When you're doing the IVF program, government does not cover the cost of annual storage of any embryos that have been created in that funded cycle. They do not cover any genetic testing, immune testing. They do not cover the cost of medications, and medications on an average IVF cycle can run you anywhere from $3,000 to maybe $8,000, depending on the clinic and the protocol and your previous history. Does not cover the cost of anesthesia if there are supplemental anesthesiologists that come in on site to your clinic for sedation. They don't cover any shipment of anything, any additional testing. So essentially the IVF program covers your monitoring that's involved, so the blood test and ultrasound. It covers the actual egg retrieval process, stuff in the laboratory, so if ICSI, where they have to inject the sperm into the eggs, is required, assisted hatching, culturing the embryos to day 5, and then the actual freezing of the embryos. And then also the embryos that are frozen under the funded IVF cycle are then later covered under the funded frozen embryo transfer program, which is also the option that if you have previously done IVF that you've paid for, and then you have gone on to decide that you're not going to do another IVF cycle, you can always speak to your clinic about their policy on transferring over those frozen embryos. If you've got them from a previous paid cycle, you can actually convert them, checking with your clinic policy first about how to go about doing that. What you would want to do is ask them if it's a possibility that your previous batch of frozen embryos can be converted to your funded cycle, and then that does disclude you from doing a fresh IVF cycle under the funded program. Now, the other thing as well that the government funded program does cover is one fertility procedure cycle for collecting and storing eggs and sperm due to medical reasons. So this is specific for those that have been diagnosed with cancer and they are looking to, preserve their fertility. Does not cover any social egg freezing. That would be something that is specific to your own needs, and it's not looked at as a requirement as yet from the government. Now, with the way about going to get on the funded program, what you would need to do is speak to your clinic nurse, doctor about it and check with them to see what their protocol is on how to get into the lottery or get on the list. I do know that some clinics are trying to facilitate as many as they can, but do keep in mind it's about 20,000 people trying to get at 5,000 spaces across Ontario for this funding. I would have to say, from a nursing perspective, I think it's been a really great thing that the government has implemented this, because it has opened up a lot of doors to people who wouldn't have been able to afford this otherwise. Now, do remember that if you're going to be part of a funded cycle, that there are consent forms. Your Ontario OHIP card has to be valid, and you must be under the age of 43 in order to participate in the program. Now, the other thing that's really important to understand is that if you are wanting to transfer more than one embryo, one of the important things to know about the funded program when you're doing IVF is that the government has stipulated that it is a single embryo transfer. And what ends up happening is that when you have your embryo transfer, if you've had, I believe, depending on your age, there are different criteria, but under the age of 35, it's a single embryo transfer. Between the age of 35 and 38, it is single embryo transfer up until you've had 3 failed transfers, and then under the doctor's discretion, it is under the discretion of the doctor, and then also the embryologist, depending on the quality of the embryos that are being transferred in. And then usually any donor embryos are always restricted to 1. Most doctors have their preference of only transferring 1, regardless if it is a funded cycle or a private pay cycle. One last important thing to know about the funded program is that they do have endpoints. So with regards to the IVF cycle, what happens is that if you have 2 attempts, and when you're going through your first attempt, if you're not responding well, and maybe the doctor had anticipated that you'd have a better response, the doctor may choose to medically cancel the cycle and say, let's start again. In situations like that, you're essentially chewing up the cost of any of the medications that you've used to date. Now, the other thing is that if you're progressing well and you decide, oh, this isn't a good time for me, you personally cannot cancel the cycle. It has to be done under medical consideration. So then that cycle would be canceled, and then you would end up going on to another cycle. Now, despite how you're going through the cycle, once you've done your cycle, and there's no guarantee what can happen from cycle to cycle, but once you're actually on the table having your eggs retrieved, that's your attempt. So you've got 2 attempts to get to that point, and if you don't, then that's it. Hopefully you'll be lucky enough that you have your 1 cycle and everything goes well, and then from there you have your eggs retrieved. Some of you may be choosing to do a fresh embryo transfer and then freezing the rest for later use. Some of you may be deciding to do genetic testing where you freeze everything and then you transfer in the subsequent cycle as well. Now, once you're done your batch of frozen embryos that are created, that is your endpoint. So the endpoints are your 2 attempts, and then once you're actually on the table having your eggs retrieved, so whether there are no eggs that are aspirated from the follicles, if there's no fertilization, that is your attempt. And then if you're doing frozen embryo transfers under the funded program, once that 1 batch has been used, then that is your attempt. Now, that covers my topic for the Ontario funded program. If you've got further questions about it, please feel free to email me at yourivfnurse@gmail.com. You can also visit my website, www.yourivfnurse.com. Thanks for watching.